Hello guys, welcome back. This is Dr. Hadi here, and I missed you a lot because I was unable to record a video lecture in the last 2 weeks. So we left at the topic of enzyme inhibition, where we studied the first part of enzyme inhibition, that was reversible inhibition. Before we shift to the irreversible inhibition, I thought I would record a video lecture on the importance of enzyme inhibition, the importance of enzyme inhibitors as drugs, or how enzyme inhibitors are used to treat diseases. Because nowadays this field has gained a lot of importance because many scientists are discovering drugs from these enzyme inhibitors. Many drugs that we use for the treatment of diseases are actually enzyme inhibitors, and the scientists in pharmaceutical chemistry, they are trying to discover more and more enzyme inhibitors so that different tough type of diseases are treated. So let's start from the enzyme inhibitor as drug and its clinical significance. Before we proceed, I would like to give you a simple example, a simple demonstration of how the enzyme inhibitors can be used as a drug. Suppose here we have an enzyme, and this is the substrate on which the enzyme acts. This one is the substrate. You know very well that substrate is anything on which the enzyme acts. So this substrate, when it acts on the enzyme, or when it is placed on the enzyme, means enzyme acts on the substrate, then the enzyme will catalyze this substrate into the product. Now this one is product. This one is our product. So I'm going to write it here as a product. This is our product. In our body, usually when an enzyme catalyzes a reaction, the products are not in excess. The products will not reach to its excess. Our body has a self-control system that will not let an enzyme to produce many product more than use. So in some occasionally it happens in pathological condition that the product become in excess, and because of this excess, what will happen? A pathological condition will be produced inside body. We call it disease. We call it what? We call it disease. And this disease came to us because of this enzyme. This enzyme is not dangerous. This enzyme is not dangerous for all of us. But in some people, sometime, what happens? That it catalyzes the reaction, it gives us product, but the product is in excess, and that excess is dangerous for us. So what we will do now? We will simply block this enzyme. We'll simply block this enzyme by using competitive inhibitors. Our lecture is already recorded on the competitive inhibitors. I have recorded a detailed video lecture on reversible enzyme inhibition. You can type and search reversible inhibition by Dr. Hadi. You will get the whole lecture. So in order to stop this enzyme, we will find another molecule which is similar to the substrate. Not 100%, but at least matching. So let's suppose this is another molecule, but this molecule is not the substrate. This molecule is a little bit similar to the substrate. This is a little bit similar to our substrate. Now there will become a competition. A competition will be produced between the substrate and the inhibitor. This is our inhibitor. This is another molecule, inhibitor. So this inhibitor will now come here and it will attach itself to the enzyme active site. This is the active site. Whenever an inhibitor attaches at the active site of the enzyme, then this inhibitor will not be converted into product. This will never convert into product, because this is what? This is inhibitor. So in other words, that reaction will be stopped and we will not be having this product. When you don't have the product, you will not be having the pathological condition and you will not be having the disease. So this is why we focus to produce different kind of drugs. So this inhibitor will be a drug for us. I will show you some example, but in the beginning we will try to give the idea in most simplest way as much as possible. There are 3 examples. However, there are a lot of examples available, but there are 3 main examples of the enzyme inhibitors. The very first one is the xanthine or hypoxanthine. Xanthine or hypoxanthine are the heterocyclic compounds. They contain nitrogen. They are a kind of alkalides. You can see they are alkalides. In today's lecture, there is no need for you to go into the structure. The structure is not important for you. However, I have already mentioned the structure on the whiteboard as well. But the purpose of today's lecture is to give you the idea of what I have mentioned on the top. Xanthine and hypoxanthine are the chemical substance that usually derived from the nucleotides, from the nucleic acid or from the protein in our body. This is the product inside our body, inside your body. Fine, xanthine or hypoxanthine. Usually it produces, and there is an enzyme called. There is an enzyme. I would like to write the diagram of that enzyme. There is an enzyme called what? Called xanthine oxidase. Xanthine, I would just like X for xanthine. Xanthine oxidase. That is xanthine oxidase. You can write it. Oxidase is an enzyme. This enzyme converts xanthine into uric acid. And this uric acid, normally it is excreted. It is excreted in the urine. But sometime in some patient, in some people, the uric acid gets in excess. Its amount is increased in the body. So this increased amount will cause a condition called gout. Gout is inflammation of the joint. Inflammation of the joint. So a lot of patients, they complain about their joint. They can't walk, they can't stand, they can't sit. This is the condition. So what we do now, the problem is that enzyme. If that enzyme is stopped from the action, we will not be having uric acid in excess. I will not be having this gout, the pathological condition. So what we do, we will create a competitive inhibitor, another molecule that its structure is matching with the substrate xanthine. So in this case, we have allopurinol. Allopurinol is another molecule, but the structure of allopyranol looks like xanthine. So in this case, if we apply allopyranol, this allopyranol will come and attaches itself to that enzyme. This is our allopyranol. Allopyranol. When the allopyranol is attached at the surface of the enzyme, the active site, then this xanthine or hypoxanthine will not be able to attach itself because the active site is already occupied. As a result, the reaction will stop and you will not see any uric acid. The uric acid level will be decreased inside your body. When the uric acid is decreased, there will be calming condition of the gout. You can see you have prevented the disease gout. Okay, let me give now shifting here to the structure. The structure, the general structure, I told you in the beginning that we are not concerned with the real structure, with 100% real structure in this video lecture, in this topic, but just giving you an idea that overall the general structure of the xanthine and hypoxanthine is like this. You have two rings, right? Ring 1, ring 2, double bond O, double bond O. And you can also see some nitrogen here and there at the corners, nitrogen here. Okay, I'm not going to make my lecture so complicated for you, just only to get the idea clear. This is the structure of xanthine or hypoxanthine, right? Xanthine or hypoxanthine. This is a structure. And you know very well, now we have designed another drug molecule which is not exactly 100% xanthine, but it looks like xanthine. And this case, this is the structure that we have now available in the market, available at the medical store, available at the pharmacy store. So this is what? This is allopyranol. Allopyranol. You can see here. This is allopyranol. It is matching structure, however different but matching structure. Okay, fine. So this is our allopyranol. I gave it the example. Next, another example is acetylcholine. Acetylcholine is a neurotransmitter. It has a lot of functions in our body, but our focus today will be when this acetylcholine act on the muscle. It has different targets in our body to work. Different targets, different functions, but one of the function is when it acts on the muscle cell, especially the skeletal muscle. You can see my bicep, you can also see your bicep. The muscle relaxes because of this acetylcholine, but the acetylcholine are very temporary when they act on the receptor. Why? They can't stay for a long time on the receptor. Why? Because once the acetylcholine attaches to the receptor, there is an enzyme. I will write here E for enzyme. The name of this enzyme is esterases. Esterases. You can also see the full name of that enzyme, that acetylcholine esterase. That's the name of the enzyme. So what this enzyme does, this enzyme break down the acetylcholine into smaller products. These products are unable to provide us the muscle relaxation. Fine. So this is a problem for the surgeon who is performing surgery. Fine. Well, if a doctor wants to perform a surgery on a patient, he or she needs the patient to be fully calm, not moving here and there. Like if he's moving here and there like this, doing something like this, the surgeon will not be able to perform surgery because he or she is going to cut a specific part in the body. Fine. So they need the patient to be calm. So they need to relax the muscle, the skeletal muscle. So what we do here, we will block this esterase enzyme by finding another competitive inhibitor, which in this case is succinylcholine. This is succinylcholine. So this succinylcholine, what it will do, it will stop this enzyme. It will stop this enzyme. If this enzyme is stopped, acetylcholine will be available. When the acetylcholine is available, there will be receptor occupied by the acetylcholine, and we will see muscle relaxation. Otherwise, if it is broken down, you will see no acetylcholine, there will be no relaxation of the muscle. So sometimes we use the drug in this way as well. Now we have another example is antibiotic. Yeah, we have lot of drugs, antibiotic available in the market, with the help of which we treat infections. Infections are very, very dangerous. They may in some time leads to the death of the patient. So now we want to control infections. One example is in case of bacteria. Now you people are inside a bacteria cell, not inside the body of the human. So if we study some of the chemical reaction inside bacteria, we go inside bacteria, you will find that how a bacteria divide. This is one bacteria, and when it divides into two bacteria, what is the most important thing for this? It has to synthesize a cell wall. Okay, fine. Important thing is it has DNA inside it. So this DNA must be duplicated into two so that it can divide. If a bacteria wants to divide into 2, into 3, into 6, into 10, into 100, into 1000, bacteria need this DNA to be replicated continuously, and this DNA replication require another very special thing that is called the folic acid. Folic acid. This folic acid is very crucial for the DNA synthesis inside bacteria. So bacteria need folic acid. Now come here. How the bacteria synthesize folic acid? There is a compound called para-aminobenzoic acid inside bacteria. What is it? It is also called PABA. It is not called BABA. It is called PABA, para-aminobenzoic acid. This para-aminobenzoic acid will be converted into folic. With the help of this para-aminobenzoic acid, folic acid is synthesized. You know, the structure of folic acid is so complicated, there is no need to write the structure of the folic acid. But you can see here that the folic acid require PABA, para-aminobenzoic acid, and this folic acid also need an enzyme, because without enzyme, this reaction is not possible. So the enzyme that we have here is dihydropterate synthase. This is an enzyme, and this enzyme will help bacteria to get folic acid, and from this folic acid bacteria division will be there. When bacteria divide, let's suppose the bacteria is inside your body, inside the body of the human. So if the bacteria is inside the body of the human, it is dividing continuously. As the result of this continuous division will be what? Will be infection. Will be what? Will be infection. Many bacteria will cause infection. So we want now to prevent this problem. How we will prevent this problem? We will stop this enzyme. We will stop this enzyme from its action. So we will find another substrate molecule. We will find another molecule with the structure of which is similar to that PABA. So in this case we have sulfanilamide. Sulfanilamide is a very well-known chemical compound, general structure that is being used for the control of infection. So if you use the sulfanilamide, then this sulfanilamide will stop this enzyme competitively. I would not let this enzyme to convert this PABA into folic acid. When there is no reaction, when there is no enzyme, no folic acid, no division, no infection. The diagram of this sulfanilamide here is this diagram. You can see here. This is the structure of the PABA, para-amino. This is amino group, and this is carboxylic group. Para-aminobenzoic acid is a very, very, very simple structure of the PABA, and this is another structure. You can see the structure is not 100% similar to the PABA, but it is little bit similar to the structure. In this case, this is called sulfanilamide. Sulfanilamide. The structure, the name is here mentioned here, sulfanilamide. Sulfur, why? Because of this sulfur group. We have sulfur atom here. So because of this sulfur atom, we call it sulfanilamide. And you know, one thing more I would like to tell you for the interest. Not only this sulfanilamide, now the scientist had thought to make more structure which are related to this sulfanilamide. Means by substituting the atoms inside this, means they have placed here another atom, bromine, let's suppose, and then they check this new chemical compound on the bacterial division, and most probably they get more potent drug than the previous one. This kind of drug will be called as analogs. You know, in the market we have a lot of drugs in the form of analogs. Once as a structure is discovered, once in the beginning one structure is discovered, then what the scientists do, the scientists make changes in that structure, small changes, and as a result of this change, he or she get another structure, he or she get another. So this one structure which was present in the beginning, that is the leader, that is the hero, that kind of compound will be called the lead compound, or the lead. Right? This is called the lead compound. And all other structures which are prepared, which are designed from this, they are called as analogs. So we are trying to make as many as possible analogs in the laboratory. This is my field. I'm also doing my PhD, and I'm very much concerned with these analogs because I am also doing research in pharmaceutical chemistry, where I work on the receptor, on the purinergic receptor. Using cancer cells, we design different kinds of drugs. That's why this lecture I shared with you. I hope you people get this idea, this brilliant idea. You got so much thing. Inshallah, in the next video lecture, we will be having more topics on this topic of enzyme chapter. So for here, give us a smile, a like, and take care. Bye-bye.